Gentlemen, if you're over 50, chances are you're taking at least one prescription medication every day. But what if I told you some of those pills might be silently making your prostate health worse? Today, we'll uncover 5 common types of medications taken by millions worldwide that could be aggravating prostate problems, messing with your hormones, or increasing urinary symptoms without you realizing it. These aren't obscure drugs. These are medications many of us use for everyday conditions like allergies, blood pressure, anxiety, or even hair loss. Stick around. We'll break down the science behind these effects, explore the risks, and share what you can do about it. Before we jump in, tell me in the comments where you're watching from. It's incredible how far this message can reach. Now, let's start with the first medication group. 1. Allergy and sleep medications. Allergy and sleep medications are widely used, especially as we age. Seasonal allergies, chronic sneezing, and insomnia can disrupt life. While these medications provide relief, many men over 50 are unaware of how they can subtly worsen prostate health. Most allergy medications and over-the-counter sleep aids contain antihistamines or anticholinergic agents. These drugs block acetylcholine, a neurotransmitter vital for bladder contraction and normal urinary function. In men with enlarged prostates, the bladder already struggles to push urine past a narrowed urethra. When anticholinergic medications reduce bladder muscle activity, the ability to empty the bladder weakens further. Clinical studies show that regular users of anticholinergic drugs experience a 45% increase in urinary symptoms such as urgency, frequency, nocturia, nighttime urination, and incomplete bladder emptying. This dramatically affects quality of life, sleep patterns, and daily comfort. Many sleep aids double as antihistamines, exacerbating these issues. While short-term use may be tolerable, chronic reliance can blunt the bladder's natural function, increasing urinary retention risk. Alternatives, such as steroid nasal sprays, avoid anticholinergic effects for allergy relief. For sleep problems, melatonin supplements or cognitive behavioral therapy, CBTI, offer safer options without compromising bladder or prostate health. If you notice a weak urine stream, frequent nighttime bathroom trips, or a sense of incomplete emptying, reassess your medications with your healthcare provider. Proactive management can prevent worsening symptoms. 2. Antidepressants and anti-anxiety medications. Antidepressants and anti-anxiety drugs improve quality of life for many, but can have unintended consequences for prostate health. Selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and tricyclic antidepressants are known to influence hormonal balance. These medications may lower circulating testosterone, a hormone critical for regulating prostate tissue. A reduction in testosterone shifts the hormone balance towards relatively higher estrogen, which is associated with benign prostatic hyperplasia, BPH, and may increase the risk for prostate cancer. A 2020 study in the Journal of Clinical Psychopharmacology found men age 55 plus taking SSRIs had significantly lower free testosterone and reported more urinary frequency, urgency, and incomplete emptying, key symptoms of prostate stress. Tricyclic antidepressants also interfere with nerve signaling to the bladder and prostate, worsening coordination and leading to symptoms like frequent urination and decreased urine flow. Anti-anxiety medications, particularly benzodiazepines, relax muscles, including the bladder outlet. While this may seem helpful, In men with enlarged prostates, this muscle relaxation can actually impair urine flow, increasing retention risk. It is critical not to stop these medications abruptly. Instead, work closely with your doctor to monitor hormone levels regularly. If sexual dysfunction, mood changes, or worsening urinary symptoms appear after starting these meds, timely adjustments can be made. Acid reflux and heartburn medications. Acid reflux, GERD, and indigestion become increasingly common with age. Proton pump inhibitors, PPIs, and H2 blockers reduce stomach acid, offering relief from heartburn. However, long-term use affects nutrient absorption, critical to prostate and overall health. PPIs and similar medications reduce absorption of magnesium, calcium, and vitamin B12, nutrients essential for nerve function, muscle control, and hormone metabolism. Vitamin B12 deficiency impairs nerve function controlling bladder and pelvic muscles, worsening urinary symptoms associated with prostate enlargement. Scientific studies show prolonged PPI use lowers testosterone production by interfering with liver enzymes necessary for hormone conversion. A 2021 review in Endocrine Reviews linked chronic PPI use with increased inflammatory markers and hormonal imbalances, risk factors for prostate growth. Magnesium deficiency related to these meds also promotes pelvic inflammation. While occasional PPI use is generally safe, chronic daily use demands regular monitoring of nutrient levels and consideration of dietary support or natural alternatives. Speak with your doctor about blood tests for B12, magnesium, and testosterone if you've been on acid reflux medications long-term. Dietary changes and natural remedies like licorice or ginger may help reduce reliance on PPIs. 4. Blood pressure and diuretics. Hypertension medications, including diuretics, are a cornerstone of cardiovascular care. However, they can have a significant impact on prostate symptoms in men over 50. Diuretics increase urine production, leading to more frequent urination and sometimes urgency, putting extra strain on the bladder. Some blood pressure meds, such as alpha blockers, actually help relax prostate muscles and improve urine flow. Others may constrict urinary pathways or have side effects worsening prostate-related urinary symptoms. For men with prostate enlargement, increased urine frequency combined with bladder irritation can worsen nocturia, urgency, and overall discomfort. Deciding on the best blood pressure medication requires careful balancing by your healthcare provider, considering both heart health and urinary function. Lifestyle factors like reduced sodium intake, weight management, and exercise can enhance medication efficacy and potentially reduce dosage needs. Regular follow-up and symptom monitoring are essential to adjust treatment and minimize adverse effects on prostate health. 5. Hair loss medications. Medications for male pattern hair loss, such as finasteride, work by inhibiting DHT, a hormone derived from testosterone. While these drugs slow hair loss, they also alter hormonal balance affecting prostate tissue. Some men report side effects, including reduced libido, erectile dysfunction, and urinary discomfort, potentially linked to hormone shifts induced by these medications. The long-term impact on prostate health remains under study, but caution is advised, especially in men with existing prostate conditions. Close medical supervision is important when using hair loss medications after age 50, with attention to any urinary or sexual side effects. Discuss all concerns with your healthcare provider and consider alternatives or dose adjustments as needed. Now that you're aware of how certain medications can impact your prostate health, it's crucial to take proactive steps to protect yourself. Start by having an open and thorough conversation with your doctor about every medication you're taking, including over-the-counter drugs and supplements. Understanding the potential side effects and exploring safer alternatives or dosage adjustments can make a big difference. Monitoring your hormone levels regularly, especially testosterone, DHT, and estrogen, is essential if you're on medications known to influence these hormones. Alongside medical oversight, adopting a healthy lifestyle is key. Regular physical activity, a balanced diet rich in anti-inflammatory foods, and effective stress management all support prostate function. Incorporating natural support such as probiotics, green tea, lycopene from tomatoes, and omega-3 fatty acids can further reduce inflammation and promote overall urinary health. Don't forget the importance of staying well hydrated and listening to your body by emptying your bladder regularly to avoid unnecessary strain. Routine prostate screenings, including PSA tests and medical checkups from age 50 onward, are vital for early detection and peace of mind. Lastly, prioritize quality sleep, as restful nights help maintain hormonal balance and overall wellness. Taking these steps will empower you to stay in control of your prostate health as you age. If you found this information valuable, please share it with someone over 50 who could benefit. Subscribe for more insights and stay proactive in your health journey.